Ladies and gentlemen, my name is Mr. Lim Kuay, Research Officer from National Institute of Health. Today, I would like to share a project entitled Methodology of the Evaluation of Komuniti Sihat Pembina Negara-Plus or KOSPEN Plus program among workers in Malaysia. According to WHO, more than 36 million people die annually from non-communicable diseases such as cardiovascular diseases, cancer, respiratory diseases, and diabetes. NCDs affect all age groups, and the risk factors are mainly due to modifiable behavior such as unhealthy diet, inadequate physical activity, tobacco, and alcohol use. In Malaysia, NCD are considered the leading causes of death, and cardiovascular diseases are responsible for most of the NCD deaths, followed by cancer, respiratory diseases, and diabetes. In view of the increasing trend of NCDs in Malaysia, the MOH or Ministry of Health Malaysia has taken a big step by embarking on a nationwide community-based intervention program, namely Komuniti Sihat Perkasa Negara or KOSPEN in 2013 to reduce the burden of NCDs among community in Malaysia. The Ministry of Health also aware that workplace is an integral part of the community, and the workers spend as much as half of their waking hour at work. Thus, in 2016, the Ministry of Health has launched a new program called Healthy Community Empower the Nation Plus or KOSPEN Plus to reduce the occurrence of non-communicable diseases among workers. This program consists of 6 mandatory and 2 optional scopes, namely healthy eating, smoke-free, active living, weight management, health screening, and mental health program. For 2 optional scopes are healthy work environment and alcohol. The objective of this study is to describe the methodology of the evaluation of Komuniti Sihat Pembina Negara-Plus program among workers in Malaysia, Phase 1. In methodology, this is a cross-sectional study design was conducted from January to March 2020. All health facilities, government and private agencies which had implemented KOSPEN Plus program between January 2016 and the 31st December 2018 in all 16 states in Malaysia were invited to participate in the study. In each health facility or agency, one of the members of the KOSPEN Plus Coordinating Committee or Occupational Safety and Health Committee was invited to participate in the study. A self-administered questionnaire or SAQ in the electronic form was used for data collection. The questionnaire was pre-tested before being administered to the respondent. The questionnaire contained 2 modules as follows. Module 1, Respondent and Organization Information. Module 2, the 8 scope of KOSPEN Plus program. Computer-assisted self-interview or Kassim approach was used to obtain data. The survey questionnaire was sent to the respondent's preferred email address. All questions must be answered by the respondent, and in order to minimize the unanswered questions, the application will automatically remind the respondent if the related questions are not answered. The quality control of the survey was done at various stages to ensure data collected was of high quality. During the data collection, the progress of the data collection for all facilities or agencies was monitored by the dedicated officer from the Institute for Public Health on a daily basis. Furthermore, all questionnaires submitted to the IPH need to undergo various checks and were verified by a verifier to ensure the validity of the answer. The study ethical approval was obtained from the Medical and Research Ethics Committee, Malaysia, Ministry of Health, and permission to conduct the study was obtained from all the health facility, government or private agencies, and participants involved. In the conclusion, the successful implementation of KOSPEN Plus program among workers in Malaysia depends greatly on the commitment from three main groups, namely Ministry of Health, the employer, and the liaison officer. The current survey was planned with the goal of obtaining data to support Ministry of Health in reviewing the present health activities related to workers' health in Malaysia and make necessary improvement to the program. It was hoped that the KOSPEN Plus program will have a positive impact on health status of workers in Malaysia. Thank you.